Ever wondered how doctors diagnose blood disorders? One key method is through a bone marrow examination. This vital diagnostic procedure evaluates the health and function of the bone marrow, that spongy tissue inside your bones responsible for producing blood cells. There are two main types of examination: bone marrow aspiration, which collects a liquid sample, and a bone marrow biopsy, a method that obtains a tissue sample. Intrigued? Perfect, because now, let's delve deeper into these two types of bone marrow examination. First up, let's explore bone marrow aspiration. This procedure is all about extracting a sample of liquid bone marrow for microscopic scrutiny. The bone marrow, remember, is the spongy tissue inside our bones where all blood cells are produced. For this procedure, we need a few things in place. Consent from the patient or their legal guardian is paramount. We also need a healthcare provider trained in bone marrow aspiration, and of course, sterile equipment, including a needle, syringe, and collection tubes. Sometimes, local anesthesia is used to numb the area where the needle will be inserted. The actual procedure goes something like this. The patient reclines on their stomach or side, exposing the hip bone. The skin over the hip bone is cleaned and numbed. A thin, hollow needle is then inserted through the bone into the marrow cavity. A syringe attached to the needle is used to draw out a sample of liquid bone marrow. Once the sample is collected, the needle is removed, and pressure is applied to the site to stop any bleeding. The collected bone marrow sample is then smeared onto a glass slide and stained using various techniques, such as Wright-Giemsa staining. The stained smear is examined under a microscope to assess the cellular composition, including the presence of blood cells, abnormal cells, and any signs of infection or disease. That's bone marrow aspiration for you. Next, we'll look at bone marrow biopsy. Now, on to the second type of bone marrow examination, the bone marrow biopsy. This procedure aims to collect a small core of bone marrow tissue for detailed examination. Similar to aspiration, the process requires the patient's consent, sterile equipment, and often local anesthesia. The patient remains in the same position as for the aspiration. After the aspiration, the biopsy may be performed at the same site or a nearby location. A larger needle or a tool called a biopsy trephine is used to extract a small core of bone marrow tissue. Once the sample is collected, the needle or trephine is removed, and pressure is applied to the site to prevent any bleeding. The bone marrow core is then prepared for examination. It's fixed, processed, and embedded into a block of wax. This creates a stable, manageable sample. Thin sections of this wax block are then cut, mounted onto slides, and stained for a detailed microscopic examination. This examination assesses the cellular composition and architecture of the bone marrow. It reveals the presence of different types of cells, their maturity, and any abnormal or diseased cells. This information is crucial for diagnosing various blood disorders and infections, and for determining the most effective treatment plan. That's the lowdown on bone marrow biopsy. Let's wrap things up now. So, we've covered the nitty-gritty of bone marrow examination. We dived deep into the details of both aspiration and biopsy, understanding how these procedures help collect samples for microscopic examination. We learned about the staining techniques, which highlight the cellular composition of the marrow, revealing any abnormal cells or signs of disease. These procedures are paramount in diagnosing blood disorders and guiding treatment decisions. Remember, these procedures are vital tools in the medical world, aiding in the diagnosis and treatment of various blood disorders. Thanks for watching.